Not eating sugar or reducing sugar intake have several evidence-based health benefits. In this video, we will identify some of the significant health benefits of not eating sugar or reducing sugar intake. High sugar intake, especially from sugary beverages and processed foods, is strongly associated with weight gain and obesity. Reducing sugar consumption can help in weight management and improve overall body composition. A meta-analysis of 30 randomized controlled trials, RCTs, found that reducing or eliminating added sugars led to significant weight loss and reduced body fat. Excessive sugar intake is a major risk factor for developing type 2 diabetes. High sugar consumption can lead to insulin resistance, impaired glucose tolerance, and increased blood sugar levels. Systematic review and meta-analysis of prospective cohort studies showed that higher consumption of sugar or sweetened beverages was associated with an increased risk of developing type 2 diabetes. High sugar intake is linked to several risk factors for cardiovascular diseases, such as obesity, high triglycerides, and blood pressure. A study published in the Journal of the American Heart Association found that higher added sugar intake was associated with an increased risk of cardiovascular mortality or death. Sugar is one of the leading causes of dental cavities and tooth decay. A systematic review of studies published in the Journal of Dental Research found a strong association between sugar intake and dental caries, particularly in children and adolescents. Excessive sugar intake, especially fructose, can lead to fat accumulation in the liver, leading to non-alcoholic fatty liver disease, NAFLD. A meta-analysis of observational studies concluded that a higher intake of sugar or sweetened beverages was associated with an increased risk of non-alcoholic fatty liver disease. High sugar intake has been linked to an increased risk of certain cancers, including pancreatic, colorectal, and breast cancers. A review of epidemiological studies published in the European Journal of Cancer Prevention found a positive association between sugar consumption and the risk of breast cancer. Excess sugar consumption has been associated with cognitive decline and an increased risk of neurodegenerative diseases like Alzheimer's. A study published in the journal Diabetologia showed that higher sugar intake was associated with a higher risk of developing Alzheimer's disease. Refined sugars can cause rapid spikes in blood sugar levels, leading to energy crashes and fatigue. A randomized controlled trial published in the American Journal of Clinical Nutrition found that low glycemic index diets, reducing sugary foods, improved energy levels and reduced feelings of fatigue compared to high glycemic index diets. High sugar consumption can contribute to chronic inflammation and associated health issues in the body. A study published in the American Journal of Clinical Nutrition found that reducing sugar intake led to decreased markers of inflammation in the body. High sugar intake can exacerbate skin conditions like acne and accelerate skin aging through a process called glycation. A study published in the Journal of the Academy of Nutrition and Dietetics reported that a low glycemic diet, low in sugar, improved acne severity in participants. It's important to note that not all sugars are harmful. Natural sugars found in whole fruits and vegetables can be part of a healthy diet. However, limiting added sugars from processed foods and sugary beverages is essential for overall health and well-being. Always consult with a healthcare professional or registered dietitian for personalized advice on dietary changes.